optimized management, we have significant data gaps that we still need to address. What's the role of these drugs in seronegative disease, which, while represent a very small population in an academic myasthenic treatment center like mine, they represent a huge percentage of our patient population because people don't know what to do, so they send them to the U, so to speak. So that has to be addressed. My belief is that these drugs are beneficial in what we would term seronegative patients. Complement won't work in musk myasthenia. FcR inhibition will. And so there are ways that we can manipulate this space. The other area we need data for is the role in children. And all of these trials, by virtue of the European Medicines Agency, require small cohorts of children be examined. And we've just completed a trial with eculizumab, and trials will soon be starting with ravulizumab and efgartigimod in children. And as newer drugs come online, zilucoplan, et cetera, they will as well. The other role is in pregnancy. And we know very little about safety in pregnancy. With complement inhibitors, there is some data out of Britain in the PNH literature that suggests its safety, but we have none such in myasthenia. So that's another data gap, if you will, that we need to address. And then the last one is that because both classes of drugs work so quickly, can we use them in myasthenic crisis or pending crisis, the patient who's acutely deteriorating, where we now rely on big doses of corticosteroids or intravenous immunoglobulin or plasma exchange to turn the patient around? Can we not use one of these compounds, which I believe could shorten the interval of intensive care time, hospitalization time, et cetera? But that's yet to be proven. And so we need that information as well. So there are a number of studies that have to be done. They're going to take time. We're hoping real-world experience will give us some of this information, and there are registries already in play that will be beneficial to the community with the knowledge we gain. But we have a ways to go. We're just scratching the new frontier. I call it the revolution in myasthenic management, and think that, these are generation 1 drugs. Generation 2, generation 4, generation 5 are in the future, where we take what we have and we improve upon it even further. And so there's a lot of cool stuff coming down the pike.